permission to record. If there's anyone that does not have permission to record, please know that we will be recording this media availability here at the Department of Health, and we can make that available to you later on for your use. All right, I believe everyone is in. We'll keep our eye on the waiting room, and we will record this here. Thank you for taking the time. I know this is school guidance, a topic of great interest, as it should be, as we try to maintain in-person learning and make sure that our Keiki are as safe as possible when they attend schools. The Department of Health has been working throughout the pandemic in close contact with the Department of Education on how to do just that, maintain in-person learning and keep our students and staff and faculty just as safe as possible. And with us now to discuss revised guidance is our state epidemiologist, Dr. Sarah Kemble, and she is joined by Deputy Superintendent from the Department of Education, Heidi Armstrong. And if I can, I'd like to now introduce Dr. Kemble to talk about our revised school guidance. Dr. Kemble.
Thank you, Brooks. We will be publishing our guidance, revised guidance for schools in the next couple of weeks, but we wanted to share decisions that have already been made in the guidance, in particular regarding masking and quarantine of those exposed to COVID-19 on campus. We wanted to get this guidance to you today rather than wait for all of the details and smaller points in the final guidance, because we hope this will help parents, students, and educators make decisions like getting vaccinated now before the school year begins. So when school begins next month, the Hawaii Department of Health will strongly encourage indoor mask use when COVID levels are high or medium. However, we will no longer recommend universal masking in most situations. This revised guidance will go into effect on August 1st. So in order to better understand the revised guidance, I'd like to review first the current guidance. So our current school guidance gives schools options. Option 1 is optional indoor masking, and option 2 is universal indoor masking. In schools with optional indoor masking, individuals can decide whether or not to wear masks, but we recommend individuals stay home and quarantine for 5 days if they were in close contact with COVID-19 on campus. This option results in a lot of students having to quarantine and miss time in the classroom. In-person learning is a priority, so missing 5 days of classroom instruction while in quarantine was less than ideal. Schools could also choose universal indoor masking, and under the universal masking option, everyone would wear a mask indoors, but we were not recommending quarantine for those who came into close contact with COVID-19 on campus. This helped satisfy our goal of in-person learning because fewer people had to quarantine. So those are the choices under our current recommendations: optional masking coupled with quarantine, or universal indoor masking with no quarantine required. Now for the revised school guidance, effective August 1st, we'll be recommending optional indoor masking, and we will be strongly encouraging students, teachers, and staff to wear masks indoors when CDC levels are medium or high. But we are not recommending universal indoor masking in most situations. And we're not recommending the 5-day quarantine for close contacts under either scenario. For example, if there's a cluster, so I do want to clarify, there are some situations where universal or targeted indoor masking will still be recommended. This is situational indoor masking. So for example, if there's a cluster in a specific classroom, we'll recommend everyone in that classroom wear masks for the duration of exposure and the quarantine period after that. We will not be recommending that students in that classroom go home to quarantine if exposed. But if there's a cluster in a classroom, then masks are a good idea. So please understand, masks are a fantastic tool, and when used correctly, they're able to prevent the spread of COVID-19. We still want everyone to consider masking indoors, and in fact, we encourage it, especially when COVID levels are high or medium. Right now, COVID levels across the state are at either high or medium. So why are we making this change now? The COVID landscape has changed. We're at a different trajectory in the pandemic at this point in time. We now have widespread availability of vaccines, and now that's open to children under 5 as well, which was not true previously. We have availability of boosters for most age groups. We have high levels of immunity at this point, both from vaccine and from natural infection from recent Omicron surges that have passed through the state. In those surges, we have seen less impact in terms of intensive care unit admissions, critical illness. So we are beginning to see a trend towards a more routine approach to disease transmission. Testing is also widely available. So with all of these strategies and continued use of other mitigation strategies in school, this is an opportunity to move forwards towards a new normal. And we think this is the right time to do so. Our revised guidance is based on the current situation, but we will continue to monitor COVID-19 trends, including new variants. And as we've seen throughout the pandemic, things can change quickly. If we do see a change in disease transmission patterns, and in particular increased severity, please know that we would revise recommendations accordingly. Parents, please take this opportunity to vaccinate your children. If they've received their first 2 shots but haven't yet been boosted, get their booster shots. We know that about 73% of students aged 12 to 17 have received their first 2 shots, but only 26% of them have received their boosters. You don't know if the student in class sitting next to your child is going to be masking or not. So now is a really good time to boost. I would like to pass on the mic now. So let's hear from Deputy Superintendent Heidi Armstrong.
Hi, good afternoon. On behalf of Superintendent Keith Hayashi, it's a pleasure to be here today with you. We are very appreciative of our close partnership with the Department of Health in helping to keep our schools open and safe for learning. As we always have, we will continue to rely on the expertise and guidance of the Department of Health when it comes to safety protocols for our schools. Although it was unpopular among some of our communities, maintaining universal indoor masking all of last school year allowed us to keep more students in school for in-person learning. That was so important after the disruption that COVID caused at the start of the pandemic and the impacts on learning and social emotional health. Now that conditions are changing and our state and nation are shifting from crisis response to learning how to live with COVID, we welcome the updated guidance to make indoor masking optional in schools, as well as the revised quarantine requirements for the upcoming school year. The department does recognize the benefits of masking, and we know it played an important role in mitigating spread on our campuses. And any student or employee who chooses to wear a mask will have that decision absolutely respected. And as Dr. Kemble shared, when the CDC determines community levels are medium or high, indoor masking will be highly recommended. Protecting the health and safety of our students and staff will most definitely continue to be a priority, and we know that the layered mitigation strategies will be key to help keep our schools safe during this transitional time. We believe that the updates from DOH that you just heard will allow our public schools to focus on our primary mission, which of course is education. When the Department of Health revises its guidance for K-12 schools, we will in turn update our health and safety guidance for our schools. The new school year begins on August 1st, and we will be following the revised guidance at that time. We will use the latest updates to provide clear and consistent guidance for our schools and offices. And we've already had a preliminary meeting with our school leaders this week on the anticipated changes. And we will meet again once we have our DOE guidance finalized. We will also help to educate parents on what the latest changes mean for their child through our back to school messaging and other communication channels. So I thank you for this opportunity to share, and we're happy to entertain any questions at this time.
Hello, I see Jen Boniza has her hand up. Jen at KHON.
Yes, thank you, Brooks. This is Jen Boniza from KHON. My question, I know that you had mentioned, Dr. Kemble, that you guys are still trying to figure out all of your guidelines for this upcoming school year. But are there, well, might be more of a DOE question, actually. Will you guys still be offering distance learning for families that have high-risk family members?
Oh, hi, this is Heidi Armstrong from the Department of Education. And yes, we will have distance learning or virtual learnings available. Some complex areas and some schools have their own distance learning programs. And we also have a state-run virtual learning program that is open to all students who apply K-12.
Okay, and I see that Esme Infante from the Star Advertiser raised her hand.
Yes, hi, thank you. I have a question that is, well, I guess it's partly for Dr. Kemble and partly for for Heidi Armstrong. Here's the thing. Can you explain what it means when we talk about medium and high community spread? Like, what are those actual thresholds? And then how, as a practical matter, would the recommendation be communicated to schools, to families, to students, so that they would actually know, oh, okay, now's the time that, masking is really, highly recommended?
Thanks, Esme. So that is something that are working on to make sure we have decision-making tools for families available on our website, on our schools page. So the levels that we're referring to are the CDC community levels. We do have links to that from our website, but we're looking at ways to make that as accessible as possible so people can see when changes are happening in their county. So that's one of the details that we're working on as we prepare the full package of guidance.
And
Yes, go ahead, please, Heidi.
And from the department standpoint, we will continue to monitor that guidance and those thresholds as they are identified. And as the geographic area in which the school falls is identified as a high or a medium risk, then we will also communicate that to our parents. And we don't have the details of that, whether that will be published on the school's website, whether it will be on our Department of Education website, or whether that will be through letters that go home to the families. But it is a detail that we need to determine, but it is on our list of to-dos before we open the school year.
Okay. Well, as a follow-up question, and thank you for all of that. As a follow-up, can you tell me, like, right now in the conditions in Hawaii, like what, maybe this is a question for Dr. Kemble then, what constitutes a medium or high? Like, what criteria are you looking at? Right now, I'm looking at the dashboard, I'm looking at positivity rates, I'm looking at, hospitalizations. What criteria are we talking about?
The CDC community levels are based on a combination of data inputs. So it's both based on the case rates that you see on our website, but it's also looking at hospital capacity. And so it's a combination of the total case counts that are being seen in a jurisdiction, but also taking into consideration how full are the hospitals and the ICU, what is the projected capacity for that hospital area.
Are we considered medium right now?
The state now, it varies by county, but it's all either high or medium currently.
Okay, thank you.
Yes, in fact, Esme, all counties, Hawaii County, Maui, and Oahu are all considered high right now, and Kauai County is considered medium. It was high until last Thursday. The CDC does update that every Thursday, and if anyone out there doesn't see it on the CDC website when they update it on Thursdays, please do follow us on our social media accounts, and we update that every Thursday.
Thank you very much.
You betcha. I'll send you some links later on. Anyone else out there with questions about the impending changes to school guidance, which will be implemented and effective come August 1st?
I have a question, Brooks. I apologize. I'm not sure why my hand isn't going up, but this is Chelsea Davis for What You News Now. I just want a clarification question. So it'll be up to the individual schools, meaning the individual principals, on whether masking will be optional?
No, universal masking is not required at this time. And so if students and staff choose to wear a mask, they absolutely can do so. But students and staff are not going to be required upon the return to school on August 1st to come to school with their masks on, and everybody practice the universal masking.
Okay, so up to the individual student, individual teacher.
Correct.
Got it. And then if there is a positive, a close contact, the recommendation is quarantine for 5 days.
Now, at this time, quarantine is not required when there has been a potential exposure. So that is a change in the guidance.
That's for in-school exposures. So household exposures would still be recommended to quarantine for 5 days and return with a mask for days 6 to 10. And that's general guidance from the CDC and general state of Hawaii guidance as well.
Got it. Thank you.
Whoops, I was muted. Sorry about that. Jeremy Lee at KITV has his hand up.
Yeah.
Jeremy, question.
Can you describe some of the situational instances where it might be appropriate? Is this around vulnerable students? Can you elaborate on that a little more?
Yeah, so for example, if a classroom is experiencing an outbreak, that there have been identified COVID-19 cases, they're exceeding certain thresholds of absenteeism for that class or a grade, that's a situation where DOH would be working with schools and upping the mitigation strategies to deal with the outbreak. So instead of a general policy of everyone masking all the time, if you have a particular classroom that's impacted by an outbreak, that class might be required to mask for the 10-day period after the last exposure in the class, for instance. So it's a much more targeted strategy, and using that masking tool in a way that is not going to impact all of the learning activities across the entire campus.
Okay, thanks.
And Esme, I still see that you have your hand up. Do you have another question?
I do have another question. This one is either for Heidi or for Sarah. I had a question about ventilation. You know, HSTA has brought this up a number of times. I think there's been some concerns voiced by the teachers, you know, about how there hasn't been adequate ventilation or ventilation assessments, I guess, of the classrooms. And I wondered, with the removal of the universal masking rule, will we see then a higher priority placed on making sure that, you know, air circulation, ventilation, air quality is good?
And start, and Heidi may also want to take this one, but from a DOH standpoint, this shift does put greater emphasis on structural or infrastructure controls, such as ventilation. Also, it relies on people really following the very important guidance of staying home when sick. We do see with the current availability, widespread availability of testing, it is possible to identify COVID cases based on symptoms very quickly and minimize exposure. So I think between staying home when sick and really strongly promoting that, plus looking at such things as ventilation, we can also do a lot of safety mitigation strategies that don't involve masking. And Heidi, I don't know if you have additional comments on DOE implementation around ventilation.
Right, and ventilation is one of the mitigation strategies, and we'll continue to work with the Department of Health in ensuring that our classrooms do have the proper ventilation. What is that? And then monitoring that we are following that guidance.
Great, thank you. As one last follow-up question, this is a question for Well, I guess it might be for Dr. Kemble. Is there any discussion about vaccine requirements, possibly having the COVID vaccine added to the list of vaccines required for entry for school?
At this time, there is no proposal on the table for requiring COVID-19 vaccine for school entry. We do obviously think it's a very good public health tool, so we strongly recommend that families consider getting all of their vaccines up to date for COVID-19.
Okay, great, thank
Dr.
you.
Kemble. Anyone else out there have a question? Please, now is a great opportunity to clarify anything. If there's anything you don't fully understand or any kind of detail you would like addressed, now is an opportunity to do it. Of course, I'll be available via email, text later on if you have follow-up questions, but you've got the two subject matter experts in front of you now, so now is a wonderful opportunity. Esme, your hand is still up. You might have another one. Or maybe you're stretching.
No, I couldn't figure out how to get it down. There you go.
Good deal. Good deal. I hope that we are all clear now on okay, Jen Boniza does have a question from KHON. Jen, thank you.
Sorry, just one more question. I just wanted to clarify, are there any social distancing guidelines still in place? I think those were removed last year, but just double checking on that.
Yes, you're correct. And the current guidance also does not place very strong emphasis on social distancing. It is difficult to accomplish all of the learning objectives that teachers have while trying to implement strict physical distancing requirements. And we've seen over time that other mitigation strategies can be used to mitigate risk. So we really are looking at trying to move towards a more normal classroom experience in this fall. Again, we'll continue to watch what happens as a result of that and monitor the data. And if we need to make adjustments, we will, but we do think this is the best opportunity we've had yet to move towards this new normal.
Thank you for clarifying. And I do have one more question for Heidi Armstrong. And this again is regarding distance learning. Heidi, you mentioned that schools will still be offering distance learning for families who want it. What is the best way for parents to go about finding out about that?
Parents can check with their school principal if the school or the complex area has a distance learning option available. And then if not, on our DOE website, there is the application for our state-sponsored distance learning program.
Thank you for explaining that.
Can I just ask a follow-up question? Heidi, how many people are in that state-sponsored program?
I think about the last I checked, it was about 115 students. And that was a couple weeks ago.
Great, thank you.
All right. One last opportunity to go around and see if anyone has anything else they'd like to follow up with. If not, I would like to give both Dr. Kemble and Deputy Armstrong an opportunity to make some closing remarks here before we let everyone go. Dr. Kemble.
I'd like to really remind parents, families, and educators of how important and what a great tool vaccine is. It's still our best tool to reduce severe illness outcomes from COVID-19. So absolutely vaccinate, get up to date on all of your shots. Masking is still a wonderful tool as well. There are going to be many parents who still decide that they would like their child to continue to mask in school. So we should all be respectful of those decisions and support that decision in the learning environment. It's really important to stay home when you're sick. This can go a long way towards preventing COVID transmission in educational settings. And this is a great opportunity to go out and get that booster. So please go get boosted today. Thank you.
Okay, and from the department side, we were really looking forward to opening school in a few weeks and welcoming our students back for in-person learning. It's going to be an exciting year ahead. We do encourage our families to continue to monitor their children. Please keep them home if they're sick or if they don't feel well. And our schools do have ample supplies, including self-test kits. So if a self-test kit is needed, please check with your child's school to get your self-test kits. Testing is a great tool to mitigate spread and to help keep our schools safe, which is our number one priority. And again, we believe that these updates from the Department of Health will allow our public schools to focus on our primary mission. And for us, that of course is education. So thank you very much for this opportunity this afternoon.
Thank you very much for both taking the time to answer questions from the media today. And those of you out there in the media, thanks for taking the time to address this important issue. We very much appreciate it. And to any parents out there, if you've been on the fence wondering whether or not you should vaccinate your child and always thought that, well, I send my child to school and the child sitting next to them will of course be wearing a mask. That is a little more uncertain as we head into the fall school year, next school year, fall semester. So please consider getting up to date on those vaccines, getting your booster if you've been waiting to do that, and your child will have that much more protection, and the entire family will have that much more protection. So thank you all for taking the time, and you know where to find me if you have follow-up questions. Dr. Kemble, Deputy Armstrong, thank you so much for taking the time this afternoon and working so hard to ensure in-person learning and that our keiki are safe at schools. Thank you.
Thank you for the opportunity.
Thank you.